Within the wider clinical negligence group at Penningtons Manches, we have a sub-team specialising in Cauda Equina claims. There are 6 members of the subgroup and we're spread across the firm's UK offices. We find that having a specialist team working on Cauda Equina claims has big advantages in terms of how to assess and manage these cases. They are cases which are normally very sensitive in terms of the issues affecting clients, they're complicated in terms of the medicine, they're usually high value and they're usually disputed by the other side. Therefore, working with these cases on a regular basis enables us to assess cases well at the outset and do our best to progress to a good outcome for clients at the end. From a client perspective, they find it helpful to know that we're familiar with the issues they're dealing with and the problems that they have.
So Cauda Equina Syndrome is a progressive condition, which means that most of the cases we deal with are relating to a delay in recognising the condition, investigating it or treating it. So most commonly a patient will turn up to their GP or an out-of-hours centre or an A&E department, and the clinicians simply don't recognise the possibility of Cauda Equina Syndrome. So they don't refer the patient for imaging or they don't refer them to the appropriate orthopaedic or neurosurgical teams. In some cases, they are referred to the correct team, but either there is a misdiagnosis on the imaging or the orthopaedic and neurosurgical teams don't act swiftly enough. Then we have some rare cases where a Cauda Equina Syndrome is actually produced by another surgical procedure, but in the vast majority of cases, it actually relates to a delay in a definitive treatment, during which time the condition has progressed and the damage is permanent.
Cauda equina is a relatively rare condition, but it can have devastating consequences, and it's therefore important to be aware of what are commonly known as red flag symptoms. This can include lower back pain and predominantly leg symptoms. This can include sciatica, which is pain radiating down one or both limbs. Some people have loss of or altered sensation in the lower limbs, and also sometimes people report symptoms of foot drop. Other symptoms include issues with sexual function and sexual sensation. Sometimes people get numbness or altered sensation in the saddle area, and what I mean by that is numbness in the groin, buttocks, anus or genitals. Finally, and almost most importantly, a lot of people report issues with bladder and bowel function, and by that, for example, I mean episodes of incontinence. If you have some of these symptoms, it doesn't necessarily mean that you have Cauda Equina Syndrome and require emergency surgery. However, some of the symptoms, especially those relating to saddle sensation and bladder and bowel function, should alert the medical practitioner to the possibility of Cauda Equina Syndrome. Essentially, anyone reporting lower back pain to either a GP or their medical practitioner, that medical practitioner should immediately be thinking about Cauda Equina and asking the patient whether they have any of the other red flag symptoms.
The longer the Cauda equina nerves are compressed, usually as a result of a slipped disc in the lower back, the more damage will occur. In most circumstances, the damage will be permanent. If left untreated, Cauda Equina Syndrome can result in permanent loss of bladder and bowel function, loss of sexual sensational function, and lower limb functional difficulties, for instance, problems mobilising the legs. Even with prompt treatment, it is not necessarily possible to prevent all symptoms arising from this condition. Often people may be left with chronic back pain or functional problems in the legs. Therefore, we do have to carefully analyse what part of the damage relates to the actual delayed diagnosis and surgery, and what damage the person would have been left with anyway, even with prompt treatment.
In order to succeed in proving a claim relating to management of Cauda Equina Syndrome, you need to prove 2 main things. The first thing you need to establish is that the treatment the claimant received was negligent, or that there's been a breach of duty. The test for negligence or breach of duty is that the care that the claimant or patient received was such that no responsible body of doctors would have acted in the same way in the same circumstances. So it's quite a high test. Usually, in the context of Cauda Equina claims, we're looking at a doctor who has failed to recognise signs of Cauda Equina Syndrome, failed to take a proper history from the patient, or failed to realise that a Cauda Equina patient is in front of them and they need to move quickly. Once we've established breach of duty or negligence, we then need to establish causation. We need to show that with proper care, the claimant or patient would have had a better outcome. This is often the more difficult part of these claims. You're dealing with a condition which has already developed by the time the patient sees a practitioner and is progressing anyway, so it's quite difficult to establish how much better a patient would have been with earlier treatment. And that is usually where the battleground is between the parties. If a patient is attended fairly early after onset of their Cauda Equina Syndrome, then if there's then a significant delay, we can usually establish that has made a difference because Cauda Equina by its nature is progressive, and the longer it's left before surgery, the more damage is caused and the more problems the patient will have. If, however, the patient doesn't arrive at a medical professional until quite a long time after their symptoms have started, or they're in a situation where their condition is progressing very quickly, or in fact any period of delay is short, it may be difficult for us to show that their outcome would have been much different even with proper care. In order to prove a case on this basis, we need to have independent medical expert evidence supporting both breach of duty, i.e. substandard care, and the fact that damage has been caused by that negligent care.
Because most cases involve a failure to consider Cauda Equina Syndrome as a potential diagnosis, often the problem that we have is actually gathering the relevant evidence. So if a clinician doesn't suspect CES, they may not ask the correct questions and they may not perform the correct tests and investigations. And that means that the medical notes don't contain the very evidence that we require. Generally speaking, surgical treatment is aimed at preventing the progression of disease rather than reversing any signs. So if a patient presents very late or with a very rapidly developing condition, often significant damage can have already been done by that stage. So even a negligent delay may have little impact. The flip side of that same coin is that if a patient presents with a very slowly developing CES, again, even a negligent delay may have very little impact. Even experts and the academic papers disagree on the significance of the timing of surgery and the prognosis. And that means that even in the case where we have liability admitted, there may be significant disputes on causation, the actual degree of harm that was caused by any negligence.
Patients suffering with the long-term effects of Cauda Equina Syndrome are often significantly disabled, and therefore when we value a claim, we look at it in two parts. The first part, we look at compensation for the person's pain, suffering and loss of amenity, and we commonly refer to that as general damages. The second part is in relation to the financial losses that person has incurred, both in the past, but also the financial losses that they may need to incur in the future, providing that those losses have been incurred as a result of the negligence. To give you some examples of the financial losses, a lot of our clients with Cauda Equina Syndrome are unable to return to work full-time, if at all. And if that's the case, we look to claim for lost earnings and loss of pension. A lot of our clients also need ongoing medical and therapy treatment in the long term. This is mainly to help manage things like the bladder and bowel issues that they continue to suffer with. If this is the case, we look to recover the costs of that treatment on a private basis. Most of our clients also need support and assistance, and this can either be from family members or potentially paid care. We therefore look at the care family members have provided in the past, as well as whether the client will need care from paid carers in the future. When people with Cauda Equina Syndrome age, bladder and bowel problems can become a real issue that requires care. Our clients also often require aids and equipment to help with their daily lives, and this can range from things like incontinence products right through to state-of-the-art wheelchairs, for example. One of the final things we look at is whether the client has any accommodation needs. And to give you some examples of that are things like the client may need single-storey accommodation or they may need a wet room. Whilst we fully appreciate that we can't turn back the clock for our Cauda Equina clients, we have seen firsthand the real difference that compensation can make to their lives.